endometrial cancer or adenomyosis. This case was that of a 60-year-old multipara who presented with foul-smelling vaginal discharge and bleeding per vaginum. On ultrasound, the uterus was extroverted and measured 5 by 4 by 4 centimeters. The endometrial thickness was 15 millimeters. There were multiple vessels with multifocal origin seen at the myometrial endometrial junction. There was also a solid ovarian lesion on the right, which measured 2 by 1 by 1. Well, this is a discussion for another video. So this is the cine loop of the case. Here one can see the 3D cine loop. This is the myometrium. This is the endometrium. As you can see, the endometrium is polypoid with subcystic changes within the polyp, which is a feature of benignity. Note the junctional zone clearly outlined. Junctional zone clearly outlined here, but at this area you can see there is interaction of the junctional zone. Remember, this is the myometrium, but here one can see infiltration of the myometrium by the endometrium here. So is this infiltration by endometrial cancer in a 60-year-old, or could this be adenomyosis? This is the 3D image. Look at where the green line is, and look at this rendered image. Again, you can see the serosa here. This is the myometrium. This is the endometrium. You can see the polypoid lesion within the endometrium. Now look at this outline here of the junctional zone. And then here you can see the extension of the endometrium into the myometrium. So what could this be? This is 60-year-old. Here comparing the 3D image with the gross specimen and histopathology. Here this asterisk represents where the polyp is. As you can see, the echogenic polyp here with cystic changes. This is the polyp within the endometrium. Then here you can see the boundary, the junctional zone. Same scene here on this gross specimen. So what about here? You see this? And this. So look at the correlation between ultrasound and the gross specimen. Of course, this lesion is also similar to what is seen here. So what is the final diagnosis now? Invasion by endometrial cancer or adenomyosis? Myometrium, endometrial glands, and stroma within the myometrium. Final diagnosis by the histopathologist, adenomyosis. Thank you very much for listening.